Okay, committee, we have one presentation today, which I think you'll find interesting, has to do with school-based Medicaid. And there's the gentleman. Thank you. Mr. Hill?
Thank you very much.
Welcome to the committee.
Thank you, Mr. Chairman, and members of this distinguished committee. My name is John Hill. I'm the Executive Director of the National Alliance for Medicaid and Education. Do you folks have copies of the information that we sent earlier?
Boy, I don't. Does anyone have that? Okay. Why don't we let our page have a copy of that?
Okay.
And,
I'm very sorry.
What's that?
I sent it a couple of days ago, and it was supposed to be forwarded to you folks.
Let's. Would you ask Jean just to make sure she hasn't already copied it, and if not, we'll quickly get a copy for all of us.
Okay. I can go ahead and start.
That'd be great.
It's pretty basic stuff. Again, I'm here representing the National Alliance for Medicaid and Education, often referred to as N.A.M.E. We couldn't come up with a better name, so we stuck with N.A.M.E. It's an organization. As an organization, it's our mission to advocate for program integrity for school-based Medicaid reimbursement. We are a national organization and focused on three main areas, which includes working directly with our federal partners at the Centers for Medicaid and Medicaid Services and the U.S. Department of Education to ensure that the resources are well utilized to support the health and education of the intended students that receive the services. We collaborate with our strategic partners at the national levels, such as the National Association of State Medicaid Directors, the National Association of Directors of Special Education, and the American Association of School Administrators, as well as several others. We facilitate a network among ourselves and among all stakeholders that include hosting an annual conference, providing topical calls for our membership and interested parties, as well as providing informal information sharing, which is what I'm considering this today. We are primarily a volunteer organization that we were founded in 2002 to connect states together who access school-based Medicaid to pay for services that are currently mandated by the federal government. Our board consists of 17 directors who are pretty well equally divided between those individuals that work for state Medicaid agencies across the country, work for state Department of Education across the country. We also have five currently, directors that work for school corporations across the country. Our organization is committed to collaboration and a clear understanding of what the program means, and we fully believe that in order for that to happen, all the players have to be at the table to have a very transparent discussion of what the expectations are and what the hopes are. I'm a founding member of the organization and past president. I've served as a the chairperson for the Governmental Affairs Committee for 10 years. A year ago, I retired for 30 years of public service from the state of Indiana, where I worked for the Department of Education for about 15 years, and I also worked for basically what you would refer to as your health and welfare division, our Family and Social Services Administration for 15 years, where I worked very closely with our Medicaid waiver programs. I was a program director for our Medicaid waiver programs for people with developmental disabilities for a number of years. I was our state director of developmental disabilities for a number of years as we were closing down our last state institutions for people with developmental disabilities. To give you a little bit of information about my background, my access on Medicaid, and my knowledge of what I have in the world of education. I'm speaking to you today based upon those experiences I've had in Indiana, as well as when working with other states and our national partners. One of the things that we're currently focusing on is to improve what we know and how states participate in school-based Medicaid. To my knowledge, all states at some level or another participate in this program, to which they participate and what outcomes they generate and their participation we're not real sure of. The federal government does not collect specific information on this program separate from the aggregate information that they collect on Medicaid in general. So we can't go to the feds and ask them, well, how much money have you spent on school-based Medicaid services? They have no way of determining that. Unfortunately, the way states report it, many states report it differently, so it's also very difficult to track. So other than contacting every state and building a relationship with them and having them provide us with the information, it's very difficult, which is what we are doing. We're building a national database, and we feel pretty confident that we're pretty close to getting there. I am knowledgeable about the program that operates in many states, and will gladly share to you with what I've learned and what I know. But you need to be aware that there are still many questions that we can't answer because of those specifics and because of the lack of data at this point in time. It's very important to note that the state of Idaho is already providing these mandated services to eligible children. You're talking about how to pay for those services that you're already delivering and currently paying for primarily with state dollars. The federal government provides less than 15% of the cost of special education services through IDEA. It's up to each state to figure out how they're going to cover the remainder of those costs. You, of course, can use 100% of your state funding to provide those unfunded portions of IDEA, or another mechanism you can use is to access Medicaid to help offset some of those costs that you're already spending for the services that you're providing, and that you can use that offset cost of money you're already spending to pay your Medicaid state match portion. I'm currently on slide number 6, in case you want to catch up a little bit. The good news is the state of Idaho has the second highest federal reimbursement rate in the nation for the Medicaid program. When I began working for the State Department of Education in 2000, neither our State Department of Education in Indiana or our state Medicaid agency wanted anything to do with the school-based Medicaid program. We had rules and regulations and even had a state law that every school had to be a provider in the state, had to be an enrolled provider in the state, but that didn't mean they had to participate. Both of our state agencies were very reluctant, and even our State Department of Education discouraged schools from participating. At that point in time, they felt the program was way too complicated for schools to administer. There were fears of federal paybacks due to audits. There was also concerns that the feds might end the program tomorrow, and what happens if the state became reliant on that money today and it wasn't there tomorrow. When the 2002 recession hit, our state budget agency got involved and made it very clear to both state agencies, you will go after federal money to especially pay for those programs that we're paying for with what they referred to in Indiana as blue and gold dollars, because they were state dollars, and basically said we're not going to spend those blue and gold dollars if there are red, white, and blue dollars that will fund those services, and mandated that the two state agencies work together to maximize the amount of federal money that could go down for those programs that the feds were mandated to be provided. Our State Department of Education and our Medicaid agency very clearly heard the message from those people that hold the money in the state. For the next 3 years, our state budget agency held monthly meetings with our agencies. This was one big meeting with both of our state agencies. There were 3 school representatives from around our state. There was a large school corporation, a small rural school corporation, and a suburban school corporation that sat on this committee. There were members of 2 parent family organizations who were on the committees, and there were also the 4 billing agencies that were the primary entities that helped schools process the claims that sat on these committees in order to assure that a collaborative and transparent program was developed that would allow schools to increase their participation in the Medicaid program while minimizing the likelihood of audit exceptions. Based upon this collaboration, there was an expanded MOU between these 2 state agencies that outlined the oversight and review responsibilities for the program. It mandated joint training between the state education agency and the Medicaid agency on training the schools. It also specified how the transfer of funds from the state from the state education agency to the Medicaid agency in order to pay the state match. And it also specified how if there was any dispute on how those disputes would be handled between those 2 state agencies. Also out of this committee basically became a billing guidebook that was developed through a contractor that explained to school corporations that were interested in becoming a Medicaid provider what all the nuances of that meant, especially in a public school world. There was also a school-based toolkit that was developed as a result of these meetings. There's over almost 300 pages long that specifies all of the information about each one of the services that schools can deliver and how those services need to be documented, provides best practice tips, and documentation requirements. And that manual has been updated 15 times since 2003 because the program continues to evolve. Back in the year 2000, before the state started this initiative to increase their access to Medicaid for school-based services, The state of Indiana had 20 out of 350 school corporations that participated in the program, and those 20 schools generated a whopping $180,000. Within 5 years of after the state implementing this increased enhancement of the program, that $180,000 turned into $8.5 million, and the number of schools increased to 147. And again, this was all at no additional cost to the state. There was no more money that was required from state appropriations for this 3,000% increase in Medicaid funding. Because what we did was we utilizing state line item money to the Department of Education to make the match for the Medicaid money. These services were already being provided. They weren't new services that were added. They didn't say, well, little Johnny now has Medicaid, so now we're going to add this to his IEP. Those services were already there. They already have to be provided. What we had to decide is who's going to pay for it and how it's going to get done. Indiana still has a lot of work to do, as well as the other 49 states and all the other territories, in order to be able to maximize the program. If we move on to slide number 7, all the funding for public services has responsibilities attached to it. Some people refer to those as strings. People don't like to take federal money because it always has, I'll say responsibilities because I'll try to be politically correct. It has responsibilities attached to those dollars. It's important to remember that Idaho's already paying for these services, but you're paying for them with your local dollars rather than the federal money. Idaho, like many other states, utilizes their state appropriations in Medicaid to pay the Medicaid state match. So you've already got the money to pay the match. This means that even if you choose to expand the program, you don't have to go find new money. You've got the money, it's already there. And you're already spending it. It's my understanding that the schools in Idaho generated approximately $20 million last year. This amount has been dwindling for a number of reasons. One of the questions you to answer is the degree that you, as legislators, want to encourage participation in this program in order to maximize the federal funding to support the IDEA mandated services. In order to bill for Medicaid services, schools must also ensure students and providers meet all their eligibility criteria to access Medicaid and that they accurately document the services that they're rendering. While in most cases these requirements are considered to be best practices anyway, there are certainly additional time and other requirements to process claims. With the introduction of more sophisticated educational software, electronic IEPs, case management tools, this burden has been significantly reduced over the past decades. It used to be that all this process had to be done by paper. It was usually multiple times that the information had to be documented. Now it's usually just one time within the student's case management tool. That information can be transferred to either the schools can process it themselves, or if they use an outside source to process the billing, that information can just be electronically transferred to them, so there's no additional burden on the school staff in order to, and especially the clinicians and the practitioners, in order to process the Medicaid billing. To further decrease the burden of administration of what can be seen from a complex program, many schools do use the provider to outsource their Medicaid claims. But not only do schools use those same providers, hospitals in this day and age, nursing homes, health clinics no longer process their own medical claims to either Medicaid or private insurance. They oftentimes outsource that. For one reason, there are so many different programs anymore. The rules are always changing. They don't have the abilities to keep their staff up to date on all the rules in order to watch over these programs adequately. If you're a school corporation and you have one person that's responsible for processing your Medicaid claims, that person becomes ill, quits their job tomorrow, who can fill their spot? Who's knowledgeable within the system? I'm really not advocating to use these vendors. If you can set up the system, that's good because it is an additional cost to schools, but there has to be a commitment from schools to do it with due diligence and put the resources into making sure that they understand the rules. Idaho is one, well, and if you move on to slide number 8, there's 3 basic reasons for audit exceptions, of which most of us know. There's fraud, and keep in mind that fraud means that somebody intentionally did something wrong for the financial gain. When that happens, people need to be prosecuted. Courts need to be involved. People often need to spend time in jail. Money needs to be paid back, and fines need to be implemented. That's fraud. There was intent to rip off the system. I'm not aware of any circumstance except for one that currently came about in this country where there has been fraud because of intent that a school system or their vendor went out and billed for things that they know they shouldn't be billing for in order to get money. There have been other audit exceptions, but there haven't been fraud. Most of those audit exceptions fall into the other two categories. One is a lack of understanding of what's allowable. If you're going to bill school-based services for Medicaid, you need to understand what the rules are. But there are a lot of rules. But still, you need to do your due diligence as best as possible to make sure that you're meeting your obligation, that you understand the rules, that you're providing training, and that your staff understand what it is. That's at the school level and the state level. The third area for those audit exceptions is around human error. I saw little Johnny yesterday. I thought, and when I recorded the service in my log, I used the date before yesterday. It was an error. I put the wrong date down. The service was still delivered. There's no fraud there. I just put down the wrong date. If an auditor comes in and sees the documentation doesn't match the date that the service was delivered, I billed for it on the 7th. I actually provided it on the 6th. I have to pay the money back. Then I can reprocess the claim again because I actually did do it. There was no fraud intended. It was just a human error. There are things that we can do to help reduce those things. You can send in automated systems. You can provide training. You can provide oversight, supervision. It's still going to happen some days. I actually make a mistake on occasion. It does happen. Idaho is one of 2 states that I'm aware of that utilizes civil penalties against other public entities under some circumstances for audit exceptions. In implementing these civil penalties, it's probably important to distinguish between those types of audit exceptions of when you're going to implement a civil penalty. I can't imagine why civil penalties would be implemented for those human errors unless they were repeated at ongoing with notification that you have a problem and you refuse to do something about it, then you're being negligent. But if it's not due to some special intent or refusing to follow the rules or learn the rules, it seems a little perplexing on why one public agency would fine another public agency. In contrast, the other state that I'm aware of that applies civil penalties when the state auditors go in and do an audit and they find their services the schools didn't bill for that they should have billed for. They recognize that this is a failure on the school's part to pull down federal money that they should be pulling down. That state, that's the circumstance that they apply a civil penalty to the school, is when they're not pulling down the money that they should already be pulling down. Moving on to slide number 9. If you decide to expand your program, it's important that your state agencies be invested in the success of these programs. This means focusing on utilizing the program to produce positive outcomes for students. It's important that the state agencies jointly provide staff training and technical assistance and not just perform audit functions. And I understand that this state is now doing joint training, which I highly commend. It's very important that they hear it from both parties, that both of your state agencies are purely invested in this program. One of them can't just say what's the other agency's responsibility. It's both agencies' responsibilities. Under IDEA, the Department of Education is mandated to meet those IDEA requirements. That includes parental consent, which is a function of this program. It's also to make sure that the students are receiving the outcomes and the means to receive those outcomes. You want your stakeholders to be knowledgeable and understand the rules so that they can operate with program integrity. It's very important that everyone involved understands the following issues: referrals for services. Who can refer for service? A physician. The federal law also allows and specifies that other members of the healing arts can also make those referrals. A state can determine who those members of the healing art are in order to help facilitate the school's ability to able to pull down these extra funds. Service authorizations. It's in most states, it's a student's IEP. It was put together by a collaborative team of individual professional professionals to determine what services the individual needs. That's the authorization for the service if the service happens to be a Medicaid eligible service for reimbursement. Practitioner credentials are extremely important. Who can deliver a school system and meet the educational requirement, who can deliver a school service and meet the educational requirements is not always the same person that will meet the requirements to bill Medicaid. Schools need to understand that. Speech therapy is probably the biggest example that we run into issues around the nation. In order to bill Medicaid, there's a certain level, educational level and certifications that those therapists have to meet and qualify to be. School systems don't necessarily and don't require their teachers or their speech therapists to meet those credentials. So if you have those individuals working within your school systems, providing those services, you would not be able to bill Medicaid for those services because it wasn't done by a qualified Medicaid practitioner. Most of them in today's world do meet the qualifications, but not all of them have. Issues around medical necessity. That was always something that has come up. Occasionally, a meeting with the Speech Therapy Association, there was concerns that schools were billing for speech services that weren't Medicaid or medically necessary. Usually what I would ask them or ask another speech therapist is if little Johnny went down the street to the local hospital for speech therapy for the same reason, would the hospital bill Medicaid? And the answer has always been yes. So therefore, there is a medical reason for it. Who determines that, how it gets determined is up for the state to decide, but they are allowable. And then there's whole issues with service documentation, which is where we hear a lot of the audit exceptions have come up over the last few years, is that the services need to be appropriately documented. This isn't only good for Medicaid, it's also good for education. If you're monitoring students' progress, I don't know how you do that if you're not adequately documenting what you're doing, when, and what the outcomes are, and what the goals are. As you're considering, and if you consider looking at expanding this program, I would encourage you to look at some other states like Montana and Arizona, New Mexico, Colorado, Iowa, and Texas. Their programs have undergone audits. Of course, auditors will always find audit exceptions. It's their job. So that's one thing that we need to be aware of. We just need to do our due diligence in making sure that everybody understands the rules. As you're aware, every state Medicaid program is different. And it's important to look at those differences when you're considering about how a program here should be developed. Those differences range from, again, those practitioner requirements, how funding and the match funding works, and how the money can be spent once it's generated. Again, I want to remind you that all this is after the fact. You've already spent the money from the service. Basically, all you're doing is claiming a rebate, to put it really simple. You've already paid for it. Now you can claim a rebate for the federal government for part of the outlay you've made. In closing, the federal and state regulations, as well as societal expectations, have forced schools to become medical providers. 20 years ago, people didn't think of schools being medical providers. Today, there are. There are students that are in a school building 8 hours a day that have an RN with them because of their special needs. Those services are reimbursable by the federal government if this child is on Medicaid. The issues at hand is how and who's going to pay for these mandated medical services that are delivered in every day in your Idaho schools. Any questions?
Thank you, Mr. Hill. Appreciate Representative Kirby.
Mr. Chairman, Mr. Hill, quick question. So the future funding from the feds on Medicaid would be of interest to me because a few years ago we were cut, and then they put in a bunch of new rules. For example, your aides, speech therapy aides, can't be charged at the same rate, and so then we had to kind of reformat, who gave those services, so we could. You have to kind of add up how much aides cost and what you're getting back, and how much speech therapists cost and how much you're getting back, and you try to figure out, how much time you're putting into all this, and it's kind of a complicated formula deciding what you're going to do. So it would matter a lot what future funding is going to be. So as we kind of strategize in our hiring practices going forward, can you speak to that at all?
Mr. Hill.
Thank you, Mr. Chairman and Representative Kirby. I can speak in that I don't have a crystal ball. I have no idea of what the federal government's going to do tomorrow. I know what we can do today. I know it'll change tomorrow. We just need to be flexible. Different states allow different services already. The state that I've spent most of my career in didn't allow for those attendant care persons to be billed at all because it wasn't a service that was in our state plan. It does affect the amount of reimbursement that schools get. One of the things that I've always cautioned about, and I remind people, this is soft money pretty much. You don't know how much is going to be there tomorrow, so you need to be cautious about what you're spending it on today. We always encourage school corporations to spend the money on training, on equipment, and not so much on staff positions. There are occasions when it does make sense. You're bringing in a lot of money. You can afford to utilize part of it. But the money not only fluctuates because of rules changing, the money also fluctuates because the populations within a school change. You may have a school, I was one of our wealthiest school corporation in the state of Indiana, who had a very small Medicaid population within its catchment area, never participated in the program until they had 4 students. They were 2 siblings from each family, that both of those students happened to receive a home and community-based waiver service. So therefore, their parental income no longer became involved in whether the family was eligible for Medicaid. So these kids were eligible for Medicaid services because of the particular Medicaid program they were on. Each of those students required 8 hours of nursing services a day in that school. That was 4 nurses the school was having to pay for out of their own funding. That school quickly became a Medicaid provider in order to get the recoupment cost back for those nurses. Not only did those students receive nursing services, but those students were also receiving speech and OT and PT and other Medicaid eligible services that the school was pulling down. And the school also had a few other Medicaid eligible students that they were able to pull down some money. If those students move on, as they move on to the school corporation, if nobody with those types of extensive needs follow them, I'm not certain the school corporation would or even should continue to participate in the program based upon what their specific needs are. It is a very local, it's a state decision on whether and how schools should participate and can participate, and it's a very local determination on if is it really worth it for the school corporation to do it. Where I get concerned, and this is the biggest battle I have at the federal level, I'm working with our federal partners, is that they always want to implement regulations because they're worried about fraud. And I keep telling them, you can implement enough regulations because you're worried about fraud that it won't occur. And the reason why it won't occur is because you made the program so complicated, nobody's going to play. Takes care of the fraud problem because nobody's billing. We understand that those people that are out there trying to rip off the system, it needs to be dealt with. There are mechanisms to deal with those individuals and those parties that are doing so. Please do so. Your neighbor, the state of Washington right now, is dealing with a case where there has been, at least from what I've heard and my understanding, there was fraud. And there were some things that particularly got intentionally done incorrectly in order to just generate money. That's a very different thing than somebody not understanding the program and doing something in error, and especially those human errors.
Mr. Hill, could I ask a question in regards to the strings?
Yes.
What, if we didn't take any money at all, do the strings change at all? Or is our hand already being forced because of this IDEA? Or if we don't take the money, do we have some flexibility that we wouldn't have otherwise?
Thank you, Mr. Chairman. If you don't have the money, the only strings that aren't attached are those that are attached to Medicaid. You still have the requirement to provide the services under the IDEA.
So you still have to do it regardless of whether you take the money. Is that what you're saying?
That is correct, sir.
Okay. Any additional questions here? Representative Harris.
I guess I have one. Thank you, Chairman.
Go ahead.
I'm in the largest school district in the state. I know that our folks in West Ada are concerned about the penalties that they get locally within the state system, and often don't want to play for those reasons. And I imagine that in the smaller districts it's even more severe. Do you know Idaho's system enough to comment on that?
Well, thank you, Representative Harrison, Mr. Chairman. Just through the conversations I've had with the school corporations, I've had a brief conversation back in August with Art Evans from your state Medicaid agency about these programs and about the purposes and the intents behind the civil penalties. I think there's probably other ways to assure compliance and improve program integrity, mostly through training and automation. Again, I'm not solely convinced that civil penalties, especially against another public institution, because all you're doing is finding one state agency is finding another state agency, and there's a bureaucratic and a financial cost involved in transferring that money from one to the other. And what does that actually do to improve the program integrity? People want to look so 4 or 5 years ago, the schools in Idaho were pulling down $30 to $35 million. Now they're pulling down $20 million. Is that because of fraud? Is that because of an emphasis on reducing fraud? There's no clear indication that there was any fraud that was involved in that $15 million that's currently not being reimbursed that was being reimbursed before. Just because the amount of money is going down that the state and the federal government's laying out doesn't mean there's been a reduction in any fraud. It may mean that they put a stranglehold on the regulations so tight that schools that would like to participate aren't willing to jump through the additional hoops because of the added bureaucratic cost that's involved. Again, there is a purpose for those regulations. I truly believe, and I want the states to go after those entities that are purposely doing it wrong. This program is vital for our schools. It is vital for our schools. States are having a difficult time at their state budgets and balancing their state budgets. I'm very, come from a state like yours that had a balanced budget amendment. I think that's where we all should operate from. I realize our federal government doesn't do that. It would be nice if we get to the point that we can. It's going to take some time if we can ever get there, and then everybody can have the philosophical discussion of is that really where we want to go or not, but that's not what we're dealing with right now. We are dealing with is the money is there now. And that if we do access it, we need to be cautious about how we're accessing it, but we need to do it with due diligence, and we need to do it in a way that has minimal impact on your state taxpayers.
Mr. Hill, thank you so much. This has been helpful and informative. All right, committee, that's everything we have for today.